everyone, welcome to iCare. So today I'm going to discuss about extraocular muscles. We have 6 extraocular muscles in our eye which is controlling our eye movements, which are superior rectus, inferior rectus, medial rectus, lateral rectus and inferior oblique and superior oblique. Pupil is the center of our eyeball. Depends on the pupil movement, we can divide the movement into 6 types. The number 1 is elevation, which is eye will move upward. Second one is depression, the eye will move downward. And the third one is adduction, the eye will move towards the nose. Fourth one is abduction, the eye will move away from the nose. Fifth one is intorsion, which is inward rotation of the eyeball, otherwise called as internal rotation. And the sixth one is extorsion, external rotation of the eyeball, which is otherwise called as external rotation. These 4 recti muscles are commonly originating from the place called annulus of Zinn. At the apex of the orbit, this will look like oval in shape on cross section. Superior rectus muscle is basically originating from the superior part of the annulus of Zinn and it is inserting into the sclera approximately 7.7 mm from the limbus. Total length of the superior rectus muscle is 42 mm in size. The actions of this muscle, primary action is elevation, secondary intorsion and tertiary adduction. An inferior rectus muscle originating from the inferior part of the annulus of Zinn and attaching into the sclera approximately 6.5 mm from the limbus. The total length of this muscle is 40 mm in size. The actions of this muscle, primary action is depression, secondary is extorsion and tertiary is adduction. Medial rectus muscle basically originating from the medial part of the annulus of Zinn and inserting into the sclera approximately 5.5 mm from the limbus. The total length of this muscle is 40 mm in size. Action of this medial rectus muscle is adduction. And this is innervated by third cranial nerve, which is oculomotor nerve. And the lateral rectus muscle basically originating from the lateral part of the annulus of Zinn, touching into the sclera around 6.9 mm from the limbus. The action of this muscle is abduction. This is supplied by 6th cranial nerve, which is the abducens nerve. The total length of this muscle is 48 mm in size. And we have 2 oblique muscles. The number 1 is superior oblique. The superior oblique muscle originating above the bony sphenoid and medial to the optic foramen by the narrow tenon and partially overlapping the origin of LPS. From there, it's traveling in between the roof and the medial wall and reaches the trochlea. From there, it is going superior-laterally and passes under the superior rectus and finally inserting into the sclera. It is inserting anteriorly 13.8 mm from the limbus, posteriorly 18.8 mm from the limbus. This is the largest and thinnest extraocular muscles. The length of this approximately 60 mm, which is 59.5 mm. This muscle is innervated by 4th cranial nerve, trochlea nerve. Primary action of the superior oblique is intorsion. Secondary action is depression and tertiary action is abduction. This arising from the rounded tenon from the shallow depression on the optical fluid of the maxilla. From there it's going latero-posteriorly between the inferior rectus and orbital floor. From there it's inserting into the sclera around 18.4 mm from the limbus. This is the very shortest extraocular muscles. The length is 37 mm. This inferior oblique is supplied by 3rd cranial nerve, which is the oculomotor nerve. Primary action of this inferior oblique is extorsion and the secondary action is elevation and tertiary action is abduction. Just remember this mnemonic called LR6SO4O3 for the nerve supply. LR is basically a lateral rectus which is supplied by 6th cranial nerve and SO is superior rectus muscle which is supplied by 4th cranial nerve and O for other muscles which is supplied by 3rd cranial nerve.